Hello, welcome to the Learn English Lab. Today's podcast, English Listening Practice Podcast topic name is 35 plus C1 level vocabulary, human anatomy, for advanced English learners. And welcome to the deep dive, the place where we cut through the noise to help you become truly well-informed. Today we're embarking on, an intimate and incredibly detailed journey. We're exploring the landscape of advanced human anatomy vocabulary.
Yeah. The C1 level terms.
Exactly. The ones that transform your English from just functional to genuinely sophisticated, more nuanced.
Right. And we know you're looking for insightful knowledge presented clearly.
Those aha moments, definitely. And a structure that respects your time.
And that's pretty much what we aim to deliver in this deep dive.
So this specific vocabulary, it goes way beyond just labeling parts, right?
Oh, absolutely. Yeah. It's incredibly valuable because it equips you with the tools for really precise communication, whether you're delving into, say, complex medical discussions or maybe crafting scientific explanations.
Or even just like richer storytelling.
Definitely. These terms add significant depth to your linguistic toolkit.
So our mission today,
it's to thoroughly dissect a carefully curated compilation of these anatomical terms. We'll give you definitions, practical applications, some alternatives.
Synonyms, yeah.
And maybe most importantly, deeper insights into their broader significance, how they fit into our understanding of the human body and, beyond.
Okay, let's begin our exploration right at the bedrock, really. The term anatomy.
Yeah, seems like the natural starting point, doesn't it?
It does?
At its core, anatomy is the scientific branch dedicated to studying the physical structure of living organisms.
Humans, animals, plants.
Right. And its fundamental importance, it can't really be overstated without understanding what is where and how it's built.
Our grasp of physiology, how things work, would be pretty superficial.
Exactly. It truly is the essential blueprint of life.
And what's fascinating is the language around it. It's not just one word. We have morphology.
Which often highlights the form and structure.
Or simply body structure. And sometimes dissection science.
Yeah, that one emphasizes the hands-on method, the investigation.
Do they carry slightly different nuances?
They certainly do. Morphology is often broader, more biological, focusing on the form itself.
Internal and external structures.
Right, and dissection science points directly to that historical, practical method.
Okay.
Now, for a practical application, medical students spend hours in the lab studying human anatomy to understand organ placement.
That highlights the hands-on immersive part, right?
Yeah.
In education.
Precisely. It's not just memorizing terms. It's about developing a profound visual and spatial understanding, like an intuitive sense of the body's interior.
That deep immersion must be indispensable for future doctors.
Absolutely. It builds that foundational empathy and, the precise knowledge needed to navigate a living patient's complexities.
Makes total sense.
Yeah.
Knowing where everything is, that's critical in the OR.
Half the battle, definitely.
But anatomy isn't just clinical, is it? It stretches into our wider understanding of life.
That's a great point. Think about evolutionary studies.
Okay.
Consider our second usage. Comparative anatomy reveals similarities between primate and human skeletons.
So comparing different species.
Exactly. This is where those interdisciplinary links really shine, especially with evolutionary biology, by studying the differences and, crucially, the commonalities.
Across species.
Scientists gain these profound insights into shared ancestry, evolutionary paths, how life adapted over millions of years.
It's like reading a biological story in the bones.
That's a perfect way to put it. It connects us all to the broader tree of life through shared structural designs.
Amazing. It's like finding ancient family resemblances written in bone. And thinking about the future, how's technology changing this field?
Well, modern tech integration is profoundly transforming anatomy study. Take our third example. Advances in digital anatomy allow for virtual dissections without physical specimens.
Virtual dissections, wow.
Yeah, it's a huge development. Think about accessibility. Students anywhere can engage with complex structures in 3D.
Dynamically, interactively?
Right. And beyond that, it brings up important ethical discussions about using cadavers.
The traditional way.
It makes us redefine what hands-on learning even means now. It shows how even ancient sciences are constantly evolving with tech and societal values.
That's powerful thought. Our understanding is always evolving.
Yeah.
Okay, moving from the big picture, let's zoom in. Let's focus on one of our key senses, turning our gaze to optical.
Optical. Right. So this defines anything relating to sight or vision.
Pretty broad, then.
Very broad. It has pervasive application not just in biology discussing the eye, but also in physics, engineering, technology.
It describes how we perceive the visual world.
From basic light reception to complex image formation, yes.
And alternatives. We've got visual, ocular, sight-related. Ocular sounds a bit more medical.
It does, yes. Ocular points specifically to the eye itself.
Got it.
Now, our first usage really nicely illustrates the psychological side. Optical illusions can trick the brain into perceiving non-existent movements.
Ah, those are always fascinating.
Aren't they? It delves into how our brains process visual data, showing the intriguing ways perception can be manipulated, even fooled.
By simple lines and colors sometimes.
Exactly. It highlights that what we see is often an interpretation built by our brain, not just a direct copy of reality.
And that interpretation can be swayed.
By clever visual stimuli.
It's amazing how our internal processing shapes our external reality. So given how complex vision is, what happens when we need professional help?
That brings us to the second example. The optometrist examined her optical health using specialized equipment.
Okay, so professional diagnostics.
Right. It underscores the systematic, precise approach optometrists and ophthalmologists use. They have an array of specialized tools.
Like ophthalmoscopes, refractors.
Exactly. And this meticulous process is essential for maintaining, correcting, or restoring vision. It directly impacts quality of life.
Healthy sight is so important. And it's not just about fixing our natural vision, right? Optical principles help enhance it too.
Good point. Our third usage shows that binoculars enhance optical clarity for birdwatching enthusiasts.
Ah, everyday enhancement tools.
Yes, it shows how the principles of optics, the science of light, extend beyond our biology. Things like binoculars, telescopes, even glasses.
They're practical extensions of optical science.
Ingeniously augmenting our natural visual capabilities, allowing us to interact with the world in new ways, whether for fun or for science.
From the wonders of sight, let's now shift our attention. Let's talk about oral, the gateway to our body and our voice too.
Oral, simple definition, involving or related to the mouth.
Simple but significant.
Immensely so. It has that profound dual role. Primary gateway for communication, speaking, singing, expressing.
And also starting digestion.
Simultaneously, yes. It's a region of intense biological activity, vital for both social interaction and sustenance.
Besides oral, you might hear buccal. That's more specific, right?
Very specific. Refers to the cheek or mouth cavity itself, often used medically, or just mouth-related.
And maybe verbal in some contexts?
Yes, but that leans more towards the spoken words themselves rather than the mouth structure.
Okay.
So first, usage focuses on health routines. Oral hygiene practices like brushing prevent cavities and gum disease.
This emphasizes preventive care.
Critically important for long-term health, and the connection between oral health and systemic well-being is huge, isn't it?
Increasingly recognized, yeah. Links to heart disease, diabetes.
Even pregnancy complications. It really shows how much our overall health starts right there in our mouths.
It's often underestimated, that link.
Yeah.
So when things do go wrong, what's the professional approach?
That leads to our second usage. The dentist performed an oral examination to check for abnormalities, clinical settings.
Routine checkups.
Dentists meticulously check not just teeth and gums, but the whole oral cavity, looking for anything abnormal.
From minor stuff like plaque.
To more serious things like inflammation, lesions, even early signs of oral cancer. It's a vital preventive step, catches problems early.
And finally, a common, maybe less pleasant, side effect of some treatments. Certain medications cause oral dryness as a side effect.
Ah, yes. This connects oral directly to pharmacology. It shows how anatomical side effects can really impact quality of life.
Oral dryness? Xerostomia.
Right. It can make chewing, swallowing, speaking uncomfortable. Plus, it increases the risk of decay.
So understanding these effects is crucial for doctors.
Absolutely. It guides medication choices and how they counsel patients, ensures comfort alongside the main treatment.
Okay, diving even deeper into the eye's complexities.
Yeah.
We encounter a tiny but vital component, the lens.
The lens. Anatomically, it's that clear, elastic, biconvex structure. Sits behind the iris to concentrate light onto the retina so we see clearly. And what's really remarkable is its ability to change shape.
Accommodation.
That's the process. It lets us focus precisely on objects near or far.
Amazing flexibility. Other names for it.
You might hear ocular lens, crystalline lens, or just eye lens.
Got it.
Our first example touches on age-related changes. Aging can cause the lens to become cloudy, leading to cataracts.
Very common condition.
Extremely. It's a physiological process where lens proteins clump together, causing cloudiness, ocalcification. Vision gets progressively impaired.
A natural part of aging for many.
Unfortunately, yes, and it can significantly diminish visual acuity if untreated.
And the lens's continuous, incredible function is shown next. The lens adjusts its shape to focus on near or distant objects.
This elaborates on that amazing physiological function. It's driven by the ciliary muscles around it.
That dynamic reshaping.
It allows for the eye's incredible adaptability and precision, constantly working in the background for a sharp view, whether close up or far away.
A marvel of biological engineering.
Truly.
But when that natural mechanism fails, modern medicine steps in.
Which brings us to the third example. Surgeons replace a damaged lens with an artificial one during cataract surgery.
Placing it in a surgical context.
Yes, one of the most common and successful surgeries globally. It shows how modern ophthalmology restores vision by removing the cloudy natural lens.
And putting in an artificial one.
An advanced intraocular lens implant. It significantly improves vision and quality of life.
Following the light path into the eye. Next, we focus on the pupil.
The pupil. That small, round, black area right in the center of the iris, the colored part.
It looks like just a hole.
But it's much more. It acts as a dynamic gateway, a variable aperture,
Controlling light entry.
actively regulating the precise amount of light reaching the retina, adapting instantly to changes in light levels.
Alternatives.
Yeah,
Eye aperture, iris center, maybe ocular pupil.
those work. Ocular pupil is more formal.
Okay.
First usage highlights its responsive behavior. In dim light, the pupil dilates to allow more light entry.
And constricts in bright light.
Exactly. This shows the involuntary neural control, the sympathetic and parasympathetic systems working constantly to optimize vision.
Ensuring the right amount of light hits the retina.
Right. Maximizing our ability to see, whether it's sunny or dark.
That automatic adjustment is remarkable. Next, how do doctors use this feature in assessments?
Aha! This links pupil directly to diagnostics. Doctors check pupil reactions as part of neurological assessments.
How the pupils react to light
Yes, their size, symmetry, reactivity, they're vital indicators of brain function.
can reveal neurological issues.
Quickly, things like nerve damage, brain injury, even drug influence. It's often a critical first step in emergency evaluations after head trauma.
And on a more everyday note, vision correction. Contact lenses must fit comfortably over the pupil for clear vision.
This relates pupil to corrective aids, highlights the precision in their design.
They sit right on the cornea, covering the pupil.
They have to provide an unobstructed, optically correct path for light. Comfort and optimal alignment are key for clear, stable vision.
Moving to the face's structure now, a prominent feature, the cheekbone.
The cheekbone. Scientifically, the zygomatic bone. It's the bone just below the eye, extending towards the ear.
It has structural and protective roles.
Yes, forms a big part of the midface, contributes to the eye socket, defines much of our facial contour, provides muscle attachments.
Other names, zygomatic bone, molar bone, facial prominence.
All correct. Zygomatic is the formal anatomical term.
Gotcha.
Our first example touches on aesthetics. High cheekbones are often considered a striking facial feature in modeling.
How anatomy becomes part of beauty standards.
Exactly. Explores how certain features get integrated into cultural ideas of beauty. High cheekbones are often linked to youth definition.
Influences art, fashion.
Definitely, from portraiture to photography.
Fascinating how bone structure carries cultural weight. But beyond looks, they're vulnerable too, aren't they?
They are, which leads to the less glamorous side. A fracture to the cheekbone required surgical reconstruction.
Focusing on injury and repair.
Right. Highlights the complexity of facial trauma. Zygomatic fractures can affect chewing, eye movement, facial symmetry.
Surgery is often needed.
Often meticulous surgery, yes, to restore not just structure, but also function, chewing, speaking, vision, and appearance.
And delving into our past, how do these differences tell bigger stories?
Here, we apply it to research. Anthropologists studied cheekbone variations across human populations.
Giving evolutionary insights.
Profound insights. Subtle differences may be influenced by diet, climate, genetics. They offer clues about human migration, adaptation, diversity throughout history.
Silent storytellers in our bones.
That's a great way to think about it.
Okay, venturing further into the mouth, let's explore the roof of the mouth.
The roof of the mouth. That's the hard inside surface at the top. Technically, the hard palate transitioning to the soft palate at the back.
It seems simple, but it does a lot.
Surprisingly crucial multifaceted role, vital for speech articulation, guiding the tongue for sounds.
Helps us swallowing too.
Yes, creates a seal to propel food down, and it's a critical barrier separating the oral and nasal cavities.
For precision, terms like palate, oral sealing, maxillary arch.
Those are good alternatives. Palate is the most common.
Okay.
First usage links it to sensory reactions. Spicy foods can irritate the roof of the mouth, causing discomfort.
Why is it so sensitive there?
Dense concentration of pain receptors, nociceptors, and thermoreceptors. They respond not just to taste, but temperature, irritating chemicals like capsaicin.
Makes it key to our sensory experience of food.
Sometimes intensely so.
Definitely felt that. Moving on, what about developmental conditions?
A more serious concern. Cleft palate affects the roof of the mouth's development in infants.
A congenital condition.
Yes, where the palate doesn't close completely during fetal development, it can significantly impact feeding, speech development.
Requires early intervention.
Often multiple surgeries, speech therapy, orthodontic care to correct function and appearance.
And something different, related to performance. Singers trained to use the roof of the mouth for better resonance.
Connecting anatomy to performance arts. Illustrates sophisticated functional use.
How did that work?
By consciously manipulating the soft palate and the oral cavity shape, singers can enhance sound quality, projection, achieve richer resonance.
Masterful command over their internal instrument.
Exactly, to produce powerful, beautiful sounds.
All right, completing our detailed look at the head, we turn to the jawbone.
The jawbone, collectively the bones forming the jaw. The upper maxilla, and especially the lower mandible.
Critically important structure.
Immensely so. Fundamentally supports our teeth, facilitates the mechanics of chewing, mastication, the crucial first step in digestion.
Specific terms.
Yeah.
Mandible for lower, maxilla for upper, or just jaw structure?
Correct. Mandible and maxilla are the precise anatomical names.
Right.
First example highlights its basic function. The jawbone supports teeth and aids in chewing mechanics.
Involves powerful muscles.
Yes, the muscles of mastication. And precise, coordinated movements to bite, grind, break down food efficiently.
Reducing food particles for swallowing and chemical digestion?
Exactly. Essential mechanical processing.
And moving way beyond the individual, how do these structures give insights into our past?
That brings us to the second usage. Fossils of ancient jawbones provide clues to dietary habits.
Putting it in paleontology, evolutionary anthropology.
Right. Anatomical evidence from fossil jaws, teeth size and shape, bone robustness, muscle attachments.
Gets historical analysis.
Remarkable insights into diets, feeding behaviors, even ecological niches of ancient species. Helps reconstruct past ecosystems, evolutionary timelines.
And finally, back to modern applications for health and looks. Orthodontic braces realign the jawbone for better bite alignment.
Details a common, effective dental treatment, explains the biomechanics.
Applying controlled forces over time.
Yes, not just moving teeth, but gradually remodeling and reshaping the underlying jaw structure.
Leads to improved bite, better aesthetics.
And contributes to long-term oral health, reducing issues like malocclusion and TMJ disorders.
Okay, before we move on, a special note on early development. The baby tooth.
A baby tooth. One of those 20 temporary teeth in young children, they fall out and get replaced by permanent adult teeth.
Also called deciduous teeth.
Right. This temporary set has a crucial evolutionary advantage. It allows the child's mouth and jaw to grow, gradually accommodating the larger adult teeth.
Ensuring proper nutrition, speech development.
During those formative years, yes.
Other names. Milk tooth, deciduous tooth, primary tooth.
All common terms.
Okay.
First usage captures a universal developmental stage. Losing a baby tooth is a common childhood milestone.
More than just biological, right? Often has cultural significance.
It absolutely marks a tangible passage, often tied to stories, traditions like the tooth fairy, a small but significant transition.
Definitely a cherished rite of passage. Next, how do dentists handle these temporary teeth?
Focuses on pediatric care. Dentists monitor baby tooth eruption to ensure proper growth.
Early oversight is important.
Crucial. Dentists check spacing, alignment, potential issues like premature loss or delayed eruption. This proactive monitoring helps prevent future orthodontic problems.
Ensuring optimal development for the permanent teeth.
Exactly.
And something familiar, even playful. A loose baby tooth can be wiggled until it falls out naturally.
Describes that common everyday experience, connects the scientific process, root resorption, detachment, to a universal childhood memory.
Usually pretty pain-free.
For most kids, yes. Marked by excitement more than discomfort, symbolizes growth and change.
Okay, having explored the head and face, let's broaden our view. Let's look at the body's main extensions and external landmarks, starting with limb.
Limb, a broad fundamental term. An arm or a leg in people or four-legged animals, or a bird's wing.
Crucial for basic function.
Absolutely. Locomotion, moving around, interacting with the environment, grasping, manipulating, providing balance and support are main tools for engaging with the world.
Alternatives. Appendage, extremity, member.
Those all work. Extremity is quite common too.
Got it.
Our first example highlights advancements in rehab tech. Prosthetic limbs restore mobility for amputees.
Showcasing engineering marvels.
Truly, they integrate seamlessly with anatomy, even neural pathways sometimes. Modern prosthetics offer incredible function and independence.
Life-changing technology.
Fundamentally transforms lives, allowing people to engage in activities thought impossible before.
Amazing. What about limbs and physical well-being?
Leads to our second usage. Exercise strengthens limb muscles for better coordination, fitness, and physical health.
Targeting limb muscles, biceps, quads.
Right. Yields significant benefits, improves strength, endurance, but also coordination, balance, proprioception, our sense of body position.
Crucial for daily activities and sports.
Promotes vitality, reduces injury risk.
And extending beyond humans. How do limbs manifest elsewhere?
Third example shows this. Birds use their limbs for perching and flight. Comparative animal anatomy.
Reverse evolutionary adaptations.
Exactly. Bird wings are exquisitely adapted forelimbs for flight. Their hind limbs are perfectly designed for perching, walking, swimming. Shows the incredible plasticity of anatomical forms shaped by evolution.
Now, let's zoom way in. One of our most sensitive functional areas. The fingertip.
The fingertip, just the area at the very end of a finger. Small, but hugely important.
Why so important?
Critical for fine sensation, distinguishing textures, temperatures, essential for dexterity, complex manipulations, and uniquely identification via fingerprints.
Other terms, finger end, digit tip, maybe phalange extremity.
Phalange extremity is quite anatomical. The others are more common.
Good.
First usage describes its neurological precision. Fingertip sensors detect touch with high sensitivity.
Why are they so sensitive?
Exceptionally dense concentration of specialized mechanoreceptors in the skin. Meissner's corpuscles for light touch, Merkel cells for pressure and texture.
This network gives amazing tactile resolution.
Crucial for fine motor skills, object recognition by touch, experiencing the world richly.
Incredible how much info we get through fingertips. Given that sensitivity, what's a common minor hazard?
Leads to a relatable experience. She pricked her fingertip while sewing a button, domestic accident, context.
Emphasizes the vulnerability of this sensitive area.
Exactly. Small punctures, cuts are frequent in tasks needing fine motor control. Reminds us how delicate these tools are.
And moving from minor accidents to high-tech uses. Biometric scanners read fingertip patterns for security.
Applies fingertip to modern tech. Links its unique features to ID and security.
Fingerprints. Unique, unchangeable.
Formed before birth, constant through life, makes them invaluable for robust security, personal ID, forensics, highly reliable verification.
A common human gesture in a powerful form. The fist.
A fist, hand with fingers tightly curled to the palm, creates a compact, solid form.
It has a dual nature.
Fascinatingly so. A potent physical tool delivering force, holding objects, and a highly expressive symbolic gesture conveying emotions, intentions.
Alternatives. Clenched hand, balled fist, gripped palm.
All accurate descriptions.
Okay.
First usage symbolizes triumph or emotion. He raised his fist in victory after the race. Illustrates nonverbal communication power.
Signifies strength, defiance, celebration.
Often transcends language barriers. Conveys success or resolve. Simple action, deep emotional resonance.
Universally understood, that gesture. Now, very differently, how is it used medically?
Details its use in medical procedures. Making a fist can help draw blood during donations. Vein access.
Why does that help?
Physiologically, clenching restricts venous return, increases muscle pressure, makes forearm veins distend, become more prominent, easier to access for venipuncture.
A small trick aiding phlebotomists.
Significantly aids them, yes.
And in sports, like boxing, there's a specific way to use a fist.
In combat sports, third usage. Boxers train to punch with a tight fist for impact. Focuses on technique, strength.
Proper fist formation is crucial.
Paramount, not just to maximize impact force, but crucially to distribute force evenly and protect the hand and wrist bones from serious self-injury.
A fundamental skill blending power, precision, self-preservation.
Absolutely.
Moving inward now, let's consider the torso, the body's central pillar.
The torso. Broadly, the upper body, excluding arms and head. Foundational structure.
The body's core.
Exactly. Housing nearly all vital organs, heart, lungs, major digestive organs, the central axis from which limbs extend.
Other names: trunk, body core, midsection.
All commonly used. Trunk is perhaps the most direct synonym.
Okay.
First example highlights muscular support and fitness. Core exercises strengthen the torso for stability.
Emphasizes deep abdominal and back muscles.
Right. A strong core is essential for good posture, balance, enabling efficient, powerful movement throughout the body.
From walking to athletics, crucial for preventing injuries too.
Definitely. You can feel the impact when your core is strong.
Next, how is the torso represented in art?
Applies to art and representation. Sculptors carve the torso with anatomical precision.
A central subject throughout art history.
Often depicted to convey strength, beauty, vulnerability. Artists meticulously study and capture its complex forms, musculature, contours.
To convey realism, expression, aesthetic appeal. Often the focal point.
Frequently, yes.
And for practical protection, especially in dangerous jobs, bulletproof vests protect the torso from impacts.
In safety gear context, focuses acutely on protection. Why the torso?
Because of the density of vital organs.
Precisely. Heart, lungs, liver, major blood vessels. Shielding this region is paramount in high-risk situations, as damage here can be immediately life-threatening.
Focusing on specific external features of the torso, let's discuss the nipple.
The nipple, the round, often pigmented area on the chest.
Primary biological function in females.
The conduit for milk during breastfeeding. But beyond that, it has varied sensory aspects, highly innervated, sensitive area in both sexes.
Synonyms: teat, often for animals, mammary papilla, breast tip.
Those are the terms, yes. Mammary papilla is more technical.
Right.
First example focuses on maternal function. Breastfeeding involves latching onto the nipple.
Essential role in infant nourishment and bonding.
Exactly. The nipple and areola structure is uniquely adapted for the suckling reflex. Fundamental aspect of early human development, providing sustenance and comfort.
And exploring a different cultural or aesthetic side. Piercings adorn the nipple in body art.
Delves into cultural aesthetic modification, examines how anatomical features become canvases for personal expression, adornment.
It's across cultures, contemporary trends.
Right. Transforms a biological feature into a site of self-expression, whether for aesthetics, identity, or personal statement.
And finally, individual variability. Sensitivity in the nipple varies among individuals.
Describes sensory aspects. Explains that nerve ending density and distribution differ significantly person to person.
Accounts for a wide range of tactile perception.
Yes. What's highly sensitive for one might be less so for another. Underscores physiological variability.
Another distinct universal feature, a mark of our beginning. The navel.
The navel, universally known as the belly button. The elevated or indented scar mid-stomach.
Formed by cutting the umbilical cord after birth.
Yes. A fascinating anatomical reminder of our origins. A permanent remnant of fetal nourishment, our connection to the mother.
Other names: belly button, umbilicus, medical, abdominal scar.
All correct. Umbilicus is the formal term.
Okay.
First usage explains its developmental origin. The navel is a remnant of fetal nourishment. Describes the umbilical cord's vital role in utero.
The lifeline connecting fetus to placenta.
For nutrients, oxygen, waste removal, the natural post-birth transformation leaves the navel a universal birthmark.
Tells a story of where we came from. Moving on, practical health considerations.
Offers health maintenance advice. Infections can occur around the navel if not cleaned.
Why?
Its often indented shape can trap lint, dead skin, sweat, creates a warm, moist environment for bacteria or fungi.
So proper hygiene is crucial.
Especially in newborns before the stump heals and with navel piercings, prevents discomfort, odor, potential infections.
And connecting to cultural practices, fashion. Some cultures pierce the navel for jewelry.
Connects navel to fashion, tradition. Explores cultural significance and contemporary trends of body modification.
Seen throughout history and popular today.
Reflects personal style, cultural identity, self-adornment, using this distinct feature as a focal point.
Descending further in our exploration, we arrive at the hip bone.
The hip bone. Either of the two large, irregular bones on each side, forming a major part of the pelvis.
Structurally critical.
Hugely part of the appendicular skeleton. The crucial junction connecting the spine, axial skeleton, to the lower limbs.
Fundamental for locomotion, weight-bearing.
And provides a protective basin for pelvic organs.
Alternatives. Pelvic bone, ilium, largest part, coxal bone.
All accurate. Coxal bone is another formal term for the hip bone as a whole.
Okay.
First example illustrates its profound structural role. The hip bone connects the spine to the legs.
Acts as a central pivot and anchor.
Essential for lower body movement, walking, running, sitting. Also for distributing body weight, absorbing shocks, maintaining posture and stability. Does a lot of heavy lifting.
A major architectural element. Next, a common concern, especially for older people. Fractures to the hip bone are common in elderly falls.
Highlights age-related injury risks. Hip fractures, often involving the femur neck, where it joins the hip.
Tragically common in older adults.
Often exacerbated by osteoporosis weakening bones. Leads to significant pain, loss of independence, challenging recovery. Makes fall prevention critical.
And for a lighter example, use in performance.
In performance arts like dance, third usage, dancers emphasize hip bone movement in routines, shows how hip mobility contributes to artistic expression.
Defines specific dance forms.
From fluid undulations in belly dance to powerful rotations in ballet or dynamic isolations in contemporary styles, conscious control adds fluidity, power, character, showcases bodily control and expressiveness.
A common yet specifically defined anatomical position. The lap.
The lap, not a distinct bone or organ, but a functional description. The upper legs forming a flat surface when seated.
Captures a universal everyday configuration.
Recognized across cultures for utility as a temporary resting surface, often associated with comfort, intimacy.
Alternatives. Thigh area, seated platform, maybe knee top.
Thigh area or seated platform work. Knee top is less common.
Okay.
First example illustrates everyday use. She held the book on her lap while reading. Reflects simple ergonomics.
A convenient, soft, stable surface.
For placing objects, books, tasks, pets. Allows comfort, hands-free activity.
Like a built-in portable table. Next, linking to animal behavior. Cats curl up on their owner's lap for warmth.
Relates lap to pet behavior, human-animal bond. Many pets instinctively seek comfort, warmth, connection using this feature.
Fosters bonding, companionship.
Demonstrates how animals leverage our physical forms for their comfort and security.
And a word directly from this concept. Laptop computers are designed for lap use.
Perfect example of anatomy influencing product design and naming, the term laptop itself.
Coined because they were engineered for lap use.
Emphasizing ergonomic design for mobile computing. Making work, entertainment accessible anywhere.
Moving to a sensitive yet crucial region. The groin.
The groin. The anatomical area where legs join the front of the body. The crease between thigh and abdomen.
Encompasses external sex organs.
Yes. An important location, often associated with vulnerability due to soft tissue, presence of vital structures, blood vessels, nerves, lymph nodes.
Other terms. Inguinal area, medical. Pelvic junction, or colloquially, crotch.
Inguinal area is a precise medical term. The others are used too.
Okay.
First usage identifies it as a common sports injury site. Athletes strain the groin during sudden movements.
Details muscle strains, often adductors.
Typically, yes. During rapid acceleration, direction changes, forceful kicking. Vulnerability makes groin strains common, often painful in sports like soccer, hockey, running.
Familiar injury for athletes.
Yeah.
Next, protective measures.
Focuses on safety equipment. Protective cups shield the groin in contact sports. Underscores why it needs protection.
Due to vulnerability, vital organs.
Impacts can be extremely painful, lead to serious injury. Protective gear is essential in contact sports to mitigate risks.
And a medical condition often associated here. Hernias often occur in the groin region.
Describes inguinal hernias, which are common. A hernia is when an organ or tissue protrudes through a weak spot.
This area is prone due to structural weaknesses.
Particularly in the abdominal wall, especially in men. Can be worsened by increased abdominal pressure, leads to discomfort, often needs surgical repair.
Expanding on that region, let's discuss genitals.
Genitals, broad term for external sex organs.
Their role is multifaceted.
Profoundly so. Beyond reproduction, encompasses identity, cultural expression, personal aspects of self, distinct features contributing to biological classification and self-sense.
Synonyms. Reproductive organs, private parts, delicate. Genitalia, clinical.
All used. Genitalia is the standard medical term.
Okay.
First example emphasizes knowledge. Education on genitals promotes sexual health awareness.
Accurate, age-appropriate knowledge is critical.
Absolutely. For promoting sexual health, understanding reproduction, preventing STIs, fostering informed decisions about one's body, foundational health education.
Foundational to understanding ourselves, making healthy choices. Next, when damaged or needing modification.
Describes reconstructive procedures. Surgeries can reconstruct damaged genitals, modern surgical advances.
Sophisticated techniques.
To restore form and function after trauma, disease, congenital conditions, or for gender affirmation. Profoundly impacts physical comfort, psychological well-being, quality of life, offers healing, self-alignment.
And finally, a social aspect varying across cultures. Modesty covers the genitals in public settings.
Discusses cultural norms, behavior, explores the universal tendency towards modesty, manifesting differently in clothing, public display.
Reflects social customs, religious beliefs, personal boundaries.
Highlights how anatomy intersects with societal expectations and comfort levels globally.
Okay, let's dive inside now. Talk about the unseen workhorses, the chemical factories, starting with glands.
A gland, an organ that produces and releases specific chemical substances.
Either used within the body, like hormones,
or discharged outside, like sweat or tears. Important to distinguish endocrine glands secreting hormones into blood.
and exocrine glands releasing via ducts onto surfaces.
Like sweat or salivary glands, yeah.
Other terms.
Yeah.
Secretory organ, endocrine gland, exocrine gland.
Those specify the type, yes.
Okay.
First example shows a key endocrine function. The thyroid gland regulates metabolism through hormone production, maintaining homeostasis.
Thyroid hormones like thyroxine are crucial messengers.
Act throughout the body, influencing nearly every cell. Maintain the body's delicate internal balance, energy, temperature, heart rate.
Keeping everything stable for optimal function.
Exactly.
Truly the body's chemical factories. Next, when glands give a warning sign.
Links glands to health indicators. Defense. Swollen glands indicate an immune response to infection.
Usually referring to lymph nodes.
Typically, yes. Small immune system organs. When fighting infection, they become active, filter pathogens, produce immune cells.
Causing them to enlarge, become palpable.
Often a key diagnostic clue for doctors.
And finally, moving to digestion, another critical role.
Focuses on exocrine roles. Salivary glands produce enzymes for digestion, located around the mouth.
Parotid submandibular sublingual glands.
They secrete saliva containing water, electrolytes, and digestive enzymes like amylase.
He starts breaking down carbs right in the mouth.
Initiates chemical digestion even before food hits the stomach.
And speaking of salivary glands, let's talk about saliva.
Saliva, the clear liquid produced continually in the mouth. Its role is remarkably multifaceted.
Lubricates food for chewing, swallowing.
Initiates chemical digestion, plays a vital protective role in oral health neutralizing acids, washing away debris, more than just spit.
Could say spit, oral fluid, salivary secretion.
Yes, those are alternatives.
Okay.
First example describes its biochemical role. Saliva contains enzymes that begin carbohydrate breakdown, salivary amylase.
Starting digestion of starches into simpler sugars immediately.
Shows digestion starts right away, makes the first bite crucial.
Working hard from the start. What if we don't produce enough?
Leads to conditions like xerostomia, dry mouth. Dry mouth reduces saliva flow, leading to discomfort. Highlights saliva's importance for health and comfort.
Makes chewing, swallowing, speaking difficult.
Painful even. Plus, the protective buffering, cleansing actions are reduced, increases risk of decay, gum disease, infections.
And a fascinating modern application. DNA tests use saliva samples for genetic analysis.
Applies saliva to forensic, medical testing. Shows its utility.
Contains cheek cells with DNA.
Vocal cells shed from the inner cheek lining, yes. Makes it convenient, non-invasive, effective source of genetic material for analyses.
Paternity tests, forensics, genetic screening.
Streamlines diagnostics significantly.
Another protective secretion, sometimes misunderstood, mucus.
Mucus is that thick, slimy, gel-like substance produced by goblet cells and mucous membranes lining passages, nose, mouth, respiratory, digestive tracts.
Its role is diverse and crucial.
Lubricates, moistens delicate surfaces. Critically forms a protective barrier trapping particles, pathogens, irritants, shields underlying tissues.
Other terms. Mucus secretion, slime, or maybe phlegm when thicker.
Yes, phlegm is often associated with coughs from the respiratory tract.
Okay.
First example highlights protective function. Mucus traps dust particles in the respiratory tract. Describes the mucociliary escalator.
Mucus traps inhale dust, pollen, Microbes.
Then tiny cilia rhythmically beat, sweeping this mucus laden with debris upwards and out of the lungs.
Preventing irritants reaching delicate lung tissue.
A natural self-cleaning air filter.
Truly. Next, a common reaction. Allergies increase mucus production, causing congestion.
Links mucus to immune reactions, symptoms. Body encounters an allergen, mounts an inflammatory response.
Releases histamine, other chemicals.
Signals mucous membranes to dramatically increase mucus production. Results in runny nose, sneezing, congestion, trying to flush out the irritant.
And practical health advice for congestion. Hydration helps thin mucus for easier expulsion.
Emphasizes a simple, effective strategy. Water is a primary component of mucus.
Dehydration makes mucus thick, sticky.
Harder to clear. Staying hydrated helps maintain optimal consistency, makes it less viscous, easier for clearing mechanisms to expel, provides relief.
A well-known hormone linked to primal responses, moments of pressure, adrenaline.
Adrenaline or epinephrine, powerful hormone from the adrenal glands atop the kidneys.
Released rapidly in response to anger, fear, excitement, stress.
Orchestrates the rapid fight-or-flight response, a vital evolutionary survival mechanism preparing the body for immediate, intense physical action.
Also here, epinephrine, stress hormone, fight-or-flight chemical.
All accurate descriptors.
Okay.
First example describes the physiological response. Adrenaline surges during emergencies, enhancing alertness. Initiates a cascade of changes.
Heart beats faster, stronger. Blood shunted to muscles. Airways dilate. Senses sharpened.
Prepares multiple systems for immediate action. Provides a burst of energy, strength, heightened awareness. Critical in life-threatening situations.
An incredible natural boost. How does it manifest competitively?
In sports, second usage. Athletes experience adrenaline rushes before competitions. Shows how it provides a performance boost.
Enhances focus, increases strength, endurance by mobilizing fuel.
Quickens reaction times. This physiological priming gives a crucial competitive edge, allows pushing physical and mental limits.
And beyond performance, a critical life-saving medical use.
Absolutely. Third usage details this. Injections of adrenaline treat severe allergic reactions. Anaphylaxis.
Acts rapidly to reverse dangerous symptoms.
Constricts blood vessels to raise pressure, relaxes airway muscles to open breathing, reduces swelling. Quick intervention can be life-saving.
Counteracts the severe physiological collapse. Essential emergency med for severe allergies.
Like bee stings or food allergies, yes.
Essential for countless biochemical reactions sustaining life. Enzymes.
An enzyme, a biological macromolecule, usually protein, produced by all living organisms.
Acts as a biological catalyst.
Brings about a specific biochemical reaction or speeds it up dramatically without being consumed or altered itself, the ultimate accelerators of life.
Underpinning nearly all cellular processes, making reactions happen millions of times faster.
Exactly.
Other terms, catalyst, biocatalyst, protein accelerator.
Highlighting their nature, yes.
Okay.
First usage focuses on metabolism. Digestive enzymes break down food into nutrients, highly specific enzymes.
Pepsin for proteins, amylase for carbs, lipase for fats.
Meticulously target and break down complex molecules into smaller absorbable nutrients. Ensures body extracts energy and building blocks.
Workhorses of digestion. What if they're missing or faulty?
Brings a significant health implication. Genetic disorders can result from enzyme deficiencies. Shows how a single missing or faulty enzyme,
Often due to genetic mutation.
can have cascading, often devastating effects, like PKU, where lack of an enzyme prevents metabolism of an amino acid, leading to toxic buildup. Highlights the precision needed.
In an interesting industrial application, industrial enzymes speed up processes like brewing.
Extends enzymes to biotechnology, harnesses their efficiency, specificity, eco-friendliness.
In brewing, breaks down starches to sugars.
Also used in detergents, food processing, biofuels. Makes industrial operations greener, more cost-effective.
A general but vital term, the fabric of our being, flesh.
Flesh. Broad encompassing term for the soft parts of the human or animal body.
Excludes bones, but includes tissues, muscles, fat, organs beneath the skin.
Correct. Speaks to the tangible substance giving form, allowing movement, sensation.
Alternatives: tissue, muscle, soft body matter.
Those describe components of flesh.
Okay.
First example highlights vulnerability. Wounds expose underlying flesh requiring sutures. Skin barrier broken.
Delicate underlying flesh exposed to environment infection.
Emphasizes healing processes but often needs medical intervention like sutures to close, protect, facilitate proper recovery.
Vivid, slightly uncomfortable image. Next, how humans use this canvas for expression.
Relates flesh to body modification. Tattoos ink designs into the flesh permanently. Physiological process.
Needles deposit indelible ink into the dermal layer.
Ink gets encapsulated by immune cells, remains embedded. Creates a permanent design, part of the soft body matter. Serves as personal, artistic, symbolic statement.
And finally, a sensitive, often taboo reference. Cannibalism involves consuming human flesh.
Touches upon an extreme taboo practice. Approach with sensitivity.
Acknowledging it occurred historically, culturally.
Driven by ritual, feminine, psychological factors, underscores profound cultural boundaries, ethical considerations around consuming human remains.
Delving deeper into digestion, immunity.
The gut.
The gut, often used for intestine or bowel, primarily refers to lower digestive tract food absorption, waste elimination.
But its importance extends beyond digestion.
Far beyond. Encompasses the vast, complex microbiome, trillions of microbes, profound connections to overall systemic health, immunity, mood, neurological function.
Might hear intestine, bowel, digestive tube.
Yes, those are common synonyms.
Okay.
First example relates to microbiome, nutrition. Probiotics promote healthy gut bacteria balance.
Yeah.
Gut microbiome is a dynamic ecosystem. Its balance is crucial for synthesizing vitamins, fermenting fiber, modulating immune system.
Probiotics, beneficial live microorganisms, help restore, maintain this balance. Positively influences nutrient absorption, digestion, even mental well-being via gut-brain axis.
Amazing how much is going on, influencing so many parts. Next, a common, often debilitating issue. Gut inflammation can lead to disorders like IBS.
Describes pathological conditions when gut balance is disrupted. Chronic inflammation or dysbiosis.
An imbalance in the microbiome.
Can significantly contribute to GI disorders like IBS, Crohn's, ulcerative colitis, cause chronic pain, bloating, altered bowel habits, impair quality of life, underscores gut susceptibility.
And finally, a fascinating metaphorical use in everyday language. Instincts are often called gut feelings.
Extends gut to idiomatic use in decision-making. Explores the intriguing link between physical sensations and intuitive subconscious responses.
The gut has its own nervous system, the second brain.
Enteric nervous system, yes, can generate powerful, unreasoned sensations. These gut feelings often serve as a primal warning system, guiding decisions when conscious thought is too slow or complex. Illustrates a deep link between body and cognition.
Moving to crucial reproductive organs, female anatomy. The ovary.
The ovary.
One of two small, almond-shaped organs in women, female mammals, beside the uterus.
Paramount role in female reproduction.
Produces eggs, over for fertilization. Also the primary site for producing key female hormones, estrogen, progesterone regulating reproductive cycle, overall female health.
Synonyms. Female gonad, egg-producing gland, oophoron.
Oophoron is the Greek-derived medical term. The others are descriptive.
Okay.
First usage describes core reproductive physiology. The ovary releases eggs during ovulation cycles. Intricate process.
Typically monthly during reproductive years, governed by hormones.
Complex interplay of brain and ovarian hormones. During ovulation, mature egg released travels down fallopian tube for potential fertilization. Critical step. And a common health concern. Cysts on the ovary can cause abdominal pain.
Addresses a prevalent issue. Ovarian cysts, fluid-filled sacs on or inside ovary. Common, often formed during normal cycle.
Many are benign, resolve on their own.
But larger or ruptured ones can cause symptoms, dull aches to sharp pain, may need medical evaluation, intervention.
And beyond egg production, its wider role.
Highlights crucial endocrine function. Hormones from the ovary regulate menstrual periods, produces estrogen, progesterone.
Pivotal for regulating cycle, thickening uterine lining, shedding if no pregnancy.
Also vital for secondary sexual characteristics, bone health, overall well-being throughout life.
Closely related, central to development. The womb.
The womb, formerly the uterus. Hollow, pear-shaped muscular organ in female pelvis.
Where fertilized egg implants, baby develops.
The specific site where the baby develops before birth. An incredible organ, sanctuary for fetal development, nurturing life from earliest stages to full term.
Other terms. Uterus, matrix, archaic, gestational organ.
Uterus is the standard medical term. The others are less common now.
Okay.
First example describes its primary function. The fetus grows in the womb for 9 months. Highlights the remarkable transformation.
From single cell to complex organism in this protective environment.
Supported by womb's ability to expand, provide nutrients, offer protection until birth.
An unparalleled feat of nature. Next, a common condition. Fibroids can form in the womb lining.
Addresses pathological growths. Uterine fibroids, leiomyomas, common non-cancerous growths in womb's muscular wall.
Size, location vary. Symptoms too.
Many women have no symptoms. Others suffer heavy bleeding, pelvic pain, pressure, sometimes infertility, often need management, sometimes surgery.
And a modern option for parenthood involving this organ. Surrogacy involves carrying a child in another's womb.
Explores modern reproductive options, complex aspects. Traditional surrogacy. Woman carries pregnancy for others.
Womb's role is still central as gestation site, but provided by third party.
Offers parenthood path for those unable to carry pregnancy themselves. Highlights flexibility, generosity of human reproductive capabilities.
Now, for male anatomy, a key gland with dual roles. The prostate.
The prostate. Walnut-sized gland in male reproductive system, below bladder, surrounding urethra.
Primary function.
Produces seminal fluid, milky fluid nourishing, protecting sperm. Also, its position around urethra gives auxiliary role in urine control.
Other names. Prostate gland, male accessory gland, urethral and circular.
Describing its function or location, yes.
Okay.
First example addresses common age-related changes. The prostate enlarges with age, affecting urination. Benign prostatic hyperplasia, BPH.
Non-cancerous enlargement, highly prevalent in older men.
As it grows, compresses urethra. Leads to bothersome urinary symptoms, frequency, weak stream, difficulty starting, incomplete emptying.
Significant issue for many. What's a crucial health measure?
Highlights preventive checks. Screenings detect prostate cancer early, one of most common male cancers.
A high survival rate if detected early.
Often, yes. Regular screenings, PSA blood test, DRE, crucial for early diagnosis, timely intervention, improving outcomes.
And finally, its direct contribution to reproduction. Fluids from the prostate nourish sperm.
Details vital reproductive role, prostatic fluid, significant part of semen volume, rich in citric acid, enzymes, PSA.
Essential for sperm viability, motility.
Nourishes sperm, provides suitable environment, helps liquefy semen after ejaculation, allowing sperm to swim freely, increasing fertilization chances.
Rounding out our vital organs, the powerhouse.
Good.
The liver.
The liver, largest internal organ, upper right abdomen, below diaphragm, absolutely vital.
Renowned for cleaning blood of harmful substances.
Primary role, but far more than a filter. Central metabolic hub, producer of essential proteins, coring factors, storage unit for vitamins, glucose, key player in digestion via bile, performs hundreds of essential functions.
Could say hepatic organ, detoxify, metabolic hub.
Yes, hepatic from Greek heper. The others describe key functions. First example describes detoxification. The liver filters toxins from alcohol consumption when alcohol or toxins enter blood.
Liver initiates complex biochemical processes with enzymes.
To break them down, neutralize toxicity, prepare for elimination. Relentless work protects body, but excessive exposure can injure the liver itself.
Incredible protection daily. Next, a serious condition impacting it. Cirrhosis scars the liver irreversibly.
It discusses disease progression. Cirrhosis, late-stage disease. Healthy tissue replaced by scar tissue, fibrosis. Irreversible damage.
Impairs vital functions, detox, protein synthesis, blood flow.
Often results from chronic diseases like hepatitis or alcohol abuse. Emphasizes liver's limited regenerative capacity in advanced stages.
And when other options fail, the ultimate intervention.
Outlines complex surgical solution. Transplants replace a failing liver, life-saving intervention for end-stage disease or acute failure.
Diseased liver replaced with healthy one from donor.
Highly complex procedure offering second chance at life. Highlights remarkable advancements in managing organ failure.
Okay, let's zoom right in now. Microscopic components coursing through us, beginning with those crucial defenders. White blood cells.
White blood cells, or leukocytes. Diverse group of cells in blood and lymph system.
Primary role.
Absolutely critical. Protect the body against diseases. The core, varied defenders of the immune system, constantly patrolling, identifying, responding to threats.
Pathogens like bacteria, viruses, foreign substances, even abnormal cell.
All of the above.
Other names. Leukocyte, immune cell, defender cell.
All accurate. Leukocyte is the formal term.
Okay.
First example details immune defense role. White blood cells fight invading pathogens, describes how different types work.
Neutrophils, lymphocytes, monocytes, each specialized.
Some engulf invaders, phagocytosis. Others produce antibodies. Others coordinate the response. A highly sophisticated internal army working together.
Truly our internal army. How do doctors use them as a health indicator?
Explains their use as a vital diagnostic marker. Counts of white blood cells indicate infections via a CBC blood test.
Measures number and types.
High count leukocytosis often signals infection or inflammation. Low count leukopenia can indicate compromised immunity or other conditions, critical diagnostic clues.
And a challenging side effect of many cancer treatments.
Describes significant side effect. Chemotherapy affects white blood cell production. Chemo targets rapidly dividing cells, like cancer.
But also bone marrow cells producing white blood cells.
Unfortunately, yes, often suppresses white blood cell production, neutropenia. This immunosuppression is common, serious, makes patients vulnerable to infections.
Complementing white blood cells, the ubiquitous vital red blood cells.
Red blood cells or erythrocytes. Most abundant blood cell type, distinctive red color.
Similar fundamental role.
Oxygen transport. Contain hemoglobin protein, efficiently binds oxygen in lungs, releases to tissues, directly links to cellular energy, survival. Without them, cells suffocate.
Might hear erythrocyte, oxygen carrier, hemoglobin cell.
All fitting descriptions. Erythrocyte is the scientific name. First example describes circulatory function. Red blood cells transport oxygen to tissues. Explains the vital gas exchange.
Hemoglobin picks up oxygen in lungs, cells pumped by heart.
Delivering O2 to every tissue for cellular respiration, energy. Simultaneously collecting CO2 waste for exhalation.
Silent workhorses keeping us alive. Next, a common related condition. Anemia reduces red blood cell counts.
Discusses common disease association. Anemia, lower red cell count, or reduced hemoglobin.
Impairs oxygen delivery.
Leads to symptoms like fatigue, weakness, shortness of breath, dizziness, pale skin, widespread health issue, mild to severe, often caused by deficiencies or chronic disease.
And a serious genetic disorder impacting shape, function. Sickle-shaped red blood cells cause blockages.
Describes sickle cell anemia. Genetic mutation causes abnormal, rigid crescent shape, especially in low oxygen.
Unlike healthy flexible cells, can't move smoothly through small vessels.
Leads to blockages, depriving tissues of oxygen, causes severe pain crises, organ damage, stroke, other life-threatening complications, devastating impact of small structural change.
Delving into structural components of tissues.
Fiber. Fiber in anatomy. Any slender, thread-like strand of muscle or nervous tissues.
Forms basic building blocks of movement, communication, structural support.
Highlights its fundamental importance. Individual fibers, usually microscopic, but collectively perform complex functions.
Other terms: filament, thread, tissue strand.
Yes, describing their slender form.
Okay.
First example details basic mechanics of motion. Muscle fibers contract for movement. Each muscle is bundles of fibers.
Stimulated by nerves, fibers shorten via sliding filament theory.
Actin and myosin proteins interact. Coordinated contraction of countless fibers generates force for all movements, from blinking to lifting. Fundamental unit of muscle action.
Credible that all movement starts at this micro level. Next, in the nervous system.
Describes neurological signaling. Nerve fibers transmit electrical impulses. Nerve fibers, axons, elongated projections of neurons.
Conduct electrical signals, action potentials, away from cell body.
This rapid, complex communication network, often insulated by myelin, underpins all bodily functions, sensation, thought, movement. Body's lightning-fast communication system.
And finally, how damage can have profound effects. Damage to optic fibers impairs vision.
Discusses sensory pathway issues. Optic nerve transmits visual info from eye to brain, composed of millions of delicate optic nerve fibers.
Their integrity is crucial for clear vision.
Damage from glaucoma, injury, disease disrupts signal transmission, leads to partial or complete vision loss. Powerfully illustrates their vital role, delicate nature.
Shifting from components to fundamental actions, starting with the vital act we do constantly. To inhale.
To inhale. Simply to take air or substances into lungs by breathing in. Fundamental involuntary physiological process. Vital for survival.
Initiates critical gas exchange, oxygen in, CO2 out.
Fuels all bodily functions, sustains life.
Synonyms: to breathe in, to inspire, to draw in.
All mean the same action. To inspire is a bit more formal. First example, mindfulness context. Yogis practice to inhale deeply for relaxation. Illustrates conscious control.
Controlled, deep breathing impacts nervous system.
Deep inhalation engaging diaphragm stimulates vagus nerve, activates parasympathetic system, promotes calm, reduces heart rate, alleviates stress. Powerful tool.
Profound tool for calming mind and body. On the flip side, a dangerous way to inhale.
Stark health risk illustration. Smokers inhale toxins into their lungs. Tobacco smoke carries thousands of harmful chemicals.
Carcinogens, irritants, toxic gases deep into delicate lung tissues.
Directly exposes respiratory system to detrimental effects. Leads to COPD, lung cancer, cardiovascular disease, severe consequences of inhaling pollutants.
And for specialized inhalation, underwater exploration.
Yeah.
Diverse inhale compressed air from tanks.
Discusses equipment-dependent breathing. Scuba divers rely on specialized gear.
Inhale compressed air mix from tanks via regulator.
Allows survival, exploration in otherwise inaccessible environments. Shows how tech extends our physiological limits, enables adventure.
The essential complementary counterpart.
To exhale.
To exhale. Breathe air or smoke out through mouth or nose. Complementary, equally vital role in respiration.
Crucial for expelling CO2 waste.
But also other functions: relaxation, temperature regulation, precise vocal control in speech, singing.
Can say to breathe out, to expire, to expel.
Correct. To expire is also slightly more formal.
Okay.
First example highlights therapeutic application. Meditation involves controlled ways to exhale stress. Slow, deliberate exhalation.
Activates parasympathetic nervous system like deep inhalation.
Lowers heart rate, reduces muscle tension, quiets mind. Promotes profound peace, reduces physiological stress responses. Simple, innate mechanism for calm.
Wonderful way to find calm. Next, how does it change during intense activity?
Physical exertion context, second usage. Runners exhale forcefully during sprints. Explains physiological need for efficient CO2 expulsion.
High-intensity exercise produces lots of CO2.
Forceful exhalation rapidly expels this waste, optimizes oxygen intake, maintains pH balance, allows sustained effort, prevents fatigue, and for artistic performance, crucial for singers.
Details vocal control technique. Precise breath control, steady controlled exhalation is paramount.
For maintaining pitch, consistent volume, sustaining notes without wavering.
Singers learn to manage diaphragm, abdominals to regulate airflow smoothly. Cornerstone of vocal artistry, allows power and neurons
Returning to actions of cells, glands.
to secrete.
To secrete. For a cell, gland, organ to produce and release a liquid substance in the body.
Yeah.
Fundamental biological action.
Important for vast array of functions, regulating via hormones, protecting via mucus, digesting via enzymes.
Links back to glands, substances they produce, highlights ubiquitous cellular activity.
Other terms, to exude, to discharge, to emit.
Describing the release action, yes.
Okay.
First example details endocrine process. Glands secrete hormones into the bloodstream. Endocrine glands like pituitary, thyroid, adrenals.
Release hormones directly into circulation. Powerful chemical messengers travel to target organs, cells. Regulate myriad functions, growth, metabolism, mood, reproduction, stress response. Maintain complex internal balance.
Constantly working, keeping us tuned. Next, how secretion provides defense.
Discusses defensive secretion. Cells secrete mucus to protect linings. Epithelial linings in respiratory, digestive, urogenital tracts.
Specialized cells secrete mucus, forming protective, lubricating barrier.
Traps pathogens, irritants, foreign particles, prevents them reaching, damaging delicate underlying tissues. Crucial first line of defense.
And an interesting comparative example. Plants secrete nectar to attract pollinators.
Fascinating comparative biology extension. Shows term secrete applies universally. Flowering plants produce, secrete nectar from nectaries.
Sugary fluid attracts pollinators like bees, butterflies, hummingbirds.
Facilitates plant reproduction. Beautiful co-evolutionary strategy.
Finally, a crucial process in circulation, often for healing, sometimes dangerous.
Yeah.
A blood clot.
A blood clot, medically thrombus, thickened gel-like mass of blood platelets, fibrin clumped together.
Dual nature, essential for wound healing.
Forms plug to stop excessive bleeding after injury, but perilous when formed inappropriately inside blood vessel. Impedes circulation, serious consequences.
Also here, thrombus, coagulation, process, clot formation.
Yes, all related terms.
Okay.
First example details serious health risk. A blood clot can block arteries, causing strokes. Clot forms in or travels to brain artery.
Blocks blood flow, deprives brain tissue of oxygen nutrients.
Leads to cell death, causing stroke. Can result in long-term disability, even death. Similar blockages in heart cause heart attacks.
Silent threat, devastating effects. Medical approaches to prevent.
Discusses medication purpose. Anticoagulants prevent blood clot formation for high-risk individuals.
Blood thinners modify blood's clotting ability.
Inhibit clotting factors or prevent platelet aggregation. Reduces risk of harmful thrombus forming, causing blockages.
And when a dangerous clot has formed, intervention needed.
Describes intervention scenario. Surgery dislodged a blood clot in the vein, when clot like DVT poses significant risk.
Risk of traveling to lungs, pulmonary embolism, or severe limb damage.
Surgical removal, thrombectomy, or other procedures used to dislodge, remove existing clots, restore circulation, critical life-saving measure. Prevents further damage, improves outcomes. Hashtag, tag, outro.
Well, there you have it. We've truly embarked on quite a deep dive through the human body's incredible complexity. We've meticulously expanded your vocabulary for human anatomy to that C1 level. I really hope you now feel a richer understanding and, greater command over these precise terms.
They're invaluable, aren't they?
For clear, sophisticated communication. In so many contexts, medical discussions, just describing the world with more accuracy.
And this learning experience, it really is so much more than just language proficiency,
Yeah.
It's about gaining a deeper, more nuanced understanding of the incredible, intricate living structures that make us who we are.
That knowledge empowers you.
To better interpret health info, engage with science articles, even make more informed observations about life itself. It encourages a kind of critical thinking that sees beyond the surface.
Connecting the dots between structure and function.
Precisely.
So what does this all mean for you listening right now? We genuinely encourage you to actively incorporate these newly acquired words into your everyday lexicon.
Don't be afraid to try them out.
Experiment with them in essays, move them into conversations, or even just, use them in your internal thoughts when observing your own body or the world.
And consider this thought. How does gaining such precise terminology for the physical self, how does it not only enhance scientific understanding, letting us describe life with unparalleled detail, but also subtly shift our perception and maybe even our appreciation for these intricate living structures that enable our very existence? It's a fascinating link between language and our experience of being. Makes you look at ourselves with renewed wonder, doesn't it?
It really does. That's a powerful thought to leave you with today. Thank you so much for joining us on this deep dive. If you enjoyed this journey into advanced anatomy vocabulary, please remember to like, share, and subscribe to our YouTube channel for more insightful explorations. Until next time, stay curious.